health and a little wealth and a lot of love.
So the next question I have is what factors do you consider before you recommend this to your patients?
So you'd mentioned earlier, surgery it's not something to take lightly. And so I think you shouldn't go into it without trying other avenues first. I think someone who has a lot of weight to lose and is having a hard time, because sometimes you get to the point where you have your ability to exercise or your ability to follow the lifestyle is a little bit harder because you have more of the comorbidities or complications from obesity. And so you have really bad arthritis, or you're debilitated because of breathing issues, or your diabetes. And so if you've tried all other things, especially if we're having a hard time managing diabetes, because some people will be on insulin and 3 different diabetic medications, and we're still having a hard time getting the diabetes under control. And so bariatric surgery can be a very effective way to stop the progression of the diabetes, because that in and of itself causes issues with your vision and your kidneys and your nerves, among other things. And so I think it shouldn't be the first option. It should be something if there's not another option.
Gotcha.
That's my personal opinion.
Okay. And then, no, I think that's good to share your personal opinion, especially since you do have a lot of experience in this. I mean, you're BC certified, right? BC medicine certified, but you have a lot of experience working with patients to help them lose weight, but not just for vanity purposes, but being a healthier version of themselves. And so I think things to talk about is like support systems and all that stuff there too, because even if you do all the work before surgery and then after surgery, if you go back to the same habits, you're just going to go back and gain all the weight back.
Yeah, and you'd mentioned this too, just from watching the show. You see that they go through a very strenuous process beforehand. 100%. And so they have to have the psychiatric evaluation. They have to show that they can be compliant. They can meet all of they can show up to all of their appointments, because you need to see the nutritionist, the dietitian. You need to have an understanding of what life is going to look like after surgery. And I think they do a good job of that now, of really putting people through a very stringent process in the beginning to make sure that they know what they're getting into, and they're going to be able to follow the recommendations after surgery.
Yeah, absolutely. I think that makes sense for sure.
With a little health and a little wealth and a lot of love, that's the life that we live. Suits and scrubs.